At around 10 a.m., Juma Masende, the coordinator of village health teams in Bumufuni sub-county, together with Abubakar Maima, the in charge of Atari Health Centre II, set off for Galilaya parish to carry out a polio immunization outreach and deworming assignment. This hard-to-reach area, with scarce health services, is home to over 1,000 people. The two health workers drive on a slippery and soggy road for about 5 kilometers. They are forced to push the car whenever it gets stuck in mud.
And routinely, in Bumufuni, we have our schedule that every month a health worker should go or come to this area to do vaccination. However, sometimes you schedule, then there's too much rain. You send, we come with the health worker, you reach here, when water is too high for the health worker to cross. We have to go back and replan.
At the end of this stretch, they abandon the car at this point because it cannot proceed to the rougher parts of the journey. They hit the road on foot, wading through deep flooded waters for the remaining 4 kilometers of the journey. This section is permanently waterlogged. The water flows from Muyembe, Simo, Atari and Girigi rivers.
There is a problem also of insurgents at times, security-wise. There is no house, there is no what. And historically, we had the place had snakes, the shrubs, and some areas are too deep to cross. That has made us have difficulty at times reaching them.
It's risky. There are snakes, sharp objects, and stones. This puts our lives at risk.
Despite the hazards, the health workers must ensure that the vaccines are not contaminated. They spend 3 to 4 hours to trek through the flooded roads. The outreach to the parish is done at least a month for services such as vaccination. Before reaching their destination, the health workers have to rest and ensure that their wet clothes dry to enable them appear presentable before the community.
Deployment has been a challenge to ladies. It has taken time because sometimes when you deploy a lady, you have seen the situation yourself, what is reaching at the neck, reaching where, so sometimes it has been hard to deploy female staffs this way.
Galilaya community in Bumufuni sub-county, Bulambuli district mainly comprises of Bagisu, Iteso and Sabine. The nearest health center is about 10 kilometers away and accessing it is hard.
Let's say the pregnant mothers are unable to cross and come and attend antenatal, come to deliver from the health facility because the waters are much, the road is muddy, and it does not allow them to cross.
From this way to that way, 10. So if a mother or a patient comes to the facility, he has to walk 10 kilometers. And if is to receive treatment and come back, he has again to walk 10 kilometers, including, you see this difficulty in water, where you fall, so at times it becomes hard.
With emergencies, residents mobilize themselves to carry patients to the health center.
There are no roads to access a health center. We have to go through this water. Often we mobilize ourselves and carry the patient to the dry land. If you delay, the patient dies. At night it's worse.
Last year, we aired a related story of Agnes Nambozo, a nurse who had to climb using ladders to one of the villages in Bulambuli district to vaccinate children at the top of a hill.